If you don't know what sepsis is, this video could potentially save your life. This video talks about how this girl ended up getting sepsis that potentially almost killed her. Unfortunately, she did not know what sepsis was, and so she let her symptoms carry on for many days. She started having a lung infection that she didn't even know she had. She started having fevers, was confused, wasn't making that much urine, and eventually she had to go to the emergency room. And at that point, she was found to have septic shock, in which her blood pressure is so low that it's not able to perfuse her organs. So she had organ failure from the kidney, from the heart, and multiple different organs. What's important for you to understand is that sepsis is when you have a unregulated infection in the body. The flu, in the brain, it could be an infection from the urine, it could be an infection from the blood, from the lungs, etc. All different forms of infection such as virus, bacteria, fungus, parasites could all do all this. So it's important that if you have sepsis, what are you going to find? You're going to find yourself having fevers, temperature above 100 Celsius, or sometimes low temperatures such as temperature below 96 Celsius, heart rate that's elevated, greater than 90 or 100 sometimes. And significantly, that's significant is if you have a blood pressure that's lower than 90 systolic or lower than your normal. That is very concerning, and any of those signs are concerning for sepsis. So you should go to the emergency room right away and don't ignore these symptoms, because oftentimes people who don't end up making it. Those are the people who go to the hospital very sick. They end up having something called septic shock, and at that point your blood pressure is so low you could go into multi-organ failure, in which treatment is very difficult sometimes, and oftentimes it requires you to go on life-saving medication to save your life.